Welcome back to Angel Winnie Nursing tutorial. In this video, we are going to study about the changing trends in pediatric nursing. Okay, last class we have studied about the ancient and we have seen that some of the modern concept of healthcare in children. So, in this video, we are going to study about the changing trends. What are the new developing pattern of the pediatric nursing? So here it is a branch of science, as we know. So this one is a branch of science, and it's the study of the child from the conception to adolescence. So what is that here? It's a study of the child from the conception to adolescence. What is a conception? The baby when the baby will conceive in the womb. Okay, conceiving a child from that to up to adolescent. We will be studying that. That is a pediatric nursing. So here, from the conception to adolescent, so there is a lot of changing trends, treating pattern, changing trends in pediatric nursing we can see. So let's see one by one. Okay. Now now the pediatric nursing is increased complexity of based on. So that is a increased complexity and increased their development. We can see in the medical care. So there is a lot of changes and nursing techniques. There is a lot of changes. You can see child care is more important from birth to 5 years because during this period mortality and morbidity rate is high. Okay, so in the medical care there is a lot of changes we can see. Okay, and that nursing techniques they are using the many nursing techniques, and child care is very important when from the birth to 5 years is very critical, and we need to give the special care to the children. And this period from zero birth to 5 years, so the children or the child will prone to get they are very high risk in the mortality and morbidity. Mortality means, as we know, so that is a red rate, and morbidity means number of disease in the population. Okay, so in that, let's see the first one, current pediatric nursing objectives. Okay, so current pediatric nursing objectives means, so current what, present what are the nursing objectives? As a nurse, what they should maintain or what they should know that their objectives. First one is foster the growth and development. Then promote an optimum state of health based on physical, mental, social health. Promote parent and child relationship. Minimize the psychological trauma of the hospitalization. Help the children to adjust to the situation and repress their feelings. Play therapy is to improve the child care. Provide comprehensive care to the children. So these all are the current pediatric nursing. So first one is to foster the growth and development. So we need to foster. So we have to help or giving treatment or feeding baby and maintain the growth and development of the children. That is the role of that is the objectives of the pediatric nursing, and promote the optimum state of health based on physical, mental, social health. So, as we know, so how we can say that the patient or the child they are healthy. So we can say they should be complete physically, they should be healthy, and mentally and socially. Socially means in this case of children, so they should mingle or they should give a social smile, not a social smile. So when we are look at the baby, baby should feel happy. So that is saying that social health. So in this case, baby has to be, the children has to be very physically fit and mentally and socially. So these all the things has to be promoted by the pediatric nursing, and promote parent-child relationship. Okay. So some parents they are not loving their children. Sometimes if the child is very sick and they couldn't give the care to the children. So we have to promote the parent-child relationship by giving the health education. That is our, as a nurse, pediatric nurse, that is our objectives. And minimize the psychological trauma of the hospitalization. So the baby, very sick baby staying in the hospital feel it's very uncomfortable staying in the hospital, and we have to minimize the psychological trauma. So shouldn't feel that baby is in the hospital, make the baby happy and giving the lot of plays and therapies, not therapy, games, and make feeling comfortable the baby in the hospital, help the children to adjust the situation and repress their feelings. So help the children, they have to be adjust within the situation, and we need to give them more toys and we have to make comfortable with that baby. Then next one is the play therapy is to improve the child care. Give him more therapy, play therapy, game. A lot of toys will be there in the hospital, pediatric hospital. You can see in the wall, and there is a lot of pictures will be there, and they will give all the toys, everything to the children and make comfortable with the children. Otherwise, they won't be comfort. They won't be coordinate with the health people, like medical professionals, a nurse also, doctor also. They won't be cooperate. Then provide comprehensive care to the children. So we have to give the complete and comprehensive care to the children. So these all are the objectives of the current pediatric objectives. Next one is the principles of children policy in India. So there are the some principles will be there. Children policy in India. India. The first one is the health program for children, including nutrition service, is very important. So we'll provide the will improve the nutrition of the children. They provide, the government has provided the health promotion, sorry, health program for the children, including the nutrition service. The next one is a provision of health care, nutrition and nutrition education for the expectant and nursing mothers. So what is a nursing mothers? Have you heard about that? So nursing mother means a feeding mother. Okay, so giving the breastfeeding now. Breastfeeding mother, we have to say the nursing mother. So we have to provide the health care and nutrition education for the nursing mother and their family, the parents, how to take care of, how to maintain the health care, how to maintain the health of the baby, nutritional education, everything have to give the education. Next one is a free and compulsory education up to the age of 14. Informal education for preschoolers and effectors to reduce the wastage and stagnation in school. So here we will give the free and compulsory education, the children's policy in India. So we'll give the free and compulsory education up to the age of 14. So up to adolescence, we'll give the free and compulsory education about what? Informal education for the preschoolers and efforts to reduce the wastage and stagnation in the schools. So they will teach them the nutritional education and their value in the educations, all the studies, everything they will give the free and compulsory education up to the age of 14 years. Then the principal is promotion of games and recreation and extracurricular activities in schools and community areas. So they will provide the or they will promote the this one activities like games, recreation, extracurricular activities in the schools and community area. So which will help the students to improve their skills and their this one activities. Okay, so this is a another principle. And next principle, special programs for the weaker children. So weaker children, so it may be a handicapped or is there any kind of this one weaker. So they will provide the special program for them. That is a special program. The next one is the facilitates for education, training, and rehabilitation for the children in distress. So the child is from the broken family, or is there any problem with the child? Maybe like very isolated child will be there. So these are the category we can say the distress children. So they for them provide the this policy provide the children policy provide the education, training and rehabilitation for the children. Rehabilitation means to come back to the normal life. Okay, so the child is comes from the broken family, so it will take the time to come back to the normal life. Then protection against neglect and cruelly exploitation. So so Dhamma, they will be neglect the poor people, or they will show the cruelty and exploitations. So this policy will be protect these kind of children and banning of child labor. So as we know, so child labor will 18. So that is the punishable thing, illegal. So that is banned in this policy. Next one is a special treatment, education, rehabilitation, and care of physically handicapped, emotionally disturbed, and mentally retarded child. Okay, same like that, we have seen the weaker children. Here also, the treatment, special treatment will provide for the education. Treatment and education rehabilitation will provide for the physically handicapped, not able to walk or not able to stand, and emotionally disturbed. So, if they having any emotional problems and mentally retarded children, they will provide the special treatment. Next one is a priority for the protection and relief children in terms of national distress and calamity. So, as we know, like, is there any calamity or the national distress for them? Provide this policy will provide the protection and relief of the children. The next principle is special programs for talented and gifted children, particularly for the weaker children. So, same like that, weaker children, they will provide the weaker children among the weaker children. So, who is more talented, for them, they will provide the special programs. So, next one is the paramount consideration in all relevant laws based upon the interest of the children. See, this policy they are giving more important to the children who is more interested to do the such activities. So they will select the people. So interest of the children, so they will provide the games or they will provide the education, everything. So they won't force. So this policy, children policy, won't force the children to do all those things. If giving treatment, education, and rehabilitation, so that is their interest of children and the play therapy, some of the game. The next one is a strengthening the family says to enable the children to grow within the family, neighborhood, and community development. So strengthen the family says to enable the children to grow. How can we strengthen the family says? So family, they're treating the children in a different way, right? So different family have different way. So they should give the value for, you should give the value to the children. So if they done any good thing, if they passed an exam, or they win any prize, so we should, as a family members, we should appreciate them, give a value for them. So which will help the children to grow and achieve more. So that is a growing within family and neighborhood and community development. So the children will have the courage or they will feel proud to achieve something more than what they like. Then, so these all are the principles of policy in India. So next we will move to the qualities of the good pediatric nurse. So as we have seen already here, some of the qualities. Again, we are going to see the qualities of good pediatric nurse. As a so good pediatric nurse, what are the qualities should be there? They should be good observer. So observe all those things. What is going on? So this is in the case of the children. So the nurse should be very observer. If it is minute signs and symptoms or if there are any abnormality you can see, they should find out. That's a good observer. And honest and truthful. Honest and truthful means what? So here we should honestly look at or we honestly observe. So simply for returning something should not do like that. And to be honest and truthful, sympathetic, kind, and cheerful. Should be sympathetic and kind. The patient is cheerful. And next one is love to work with children. Yes, obviously. Not be like very cruel or very rude. And working with children means we should feel like good relationship, and we should feel happy with them, make them happy, and love to work with children. The next one is interested in family care, right? So we should teach the family how to take care of the children, especially sick children, always crying. So the nurses has to be teach the family members how to handle this crying of sick children and able to provide teaching to the children and their family. Same like that. Provide the teaching to children and their family how to take care of the children. So these all are the qualities of the good pediatric nurse. So next one is the role of psychiatric nurse. So in the trends we are seeing now. So fourth one, the role of psychiatric nurse. The So next one is the role of pediatric nurse. The pediatric nurse's role is a unique because of developmental immaturity and vulnerability of children. The goals of nursing care of children based upon primary health care. Yeah. So here giving the role of the pediatric nurse based upon the primary health care. So what are the primary health cares are? Let's see. So here, promote the health maturation as a physical, intellectual, emotional being within the context of his family and communities. So that is a primary care and provide health care for the child with who require treatment from disease. That is a secondary level. And third is dealing with the children disabilities. Therefore, the role of the pediatric nurse includes that is a tertiary level. So mainly the role of the pediatric nurse. Okay, it is based on the three this one criteria. So we can say the criteria, whatever. And such one is the primary level and the secondary level and the tertiary level. So according to that, we will give the as a pediatric nurse will give the care or the treatment. So first one, let's see the in the primary level, what they will do. Though health education to children and his parents providing the children's basic needs and immunization. So here the primary level, first of all, before getting the disease, so as a precaution, so what we will do? So we will immunization, we'll give the immunization to the children, right? So within the 9 days after the birth of the baby has to be take the BCG vaccine that we know. So that within the 9 days has to be taken. So same like that, why we are giving the immunization to prevent the disease before getting that. Before getting the disease, we should be take the precautions. So that is a vaccine. Here, the health education to the children and some parents, providing the child basic needs of immunization. Here, the immunization has to be maintained. That's a primary. Before getting the disease, has to be immunize the patient or the children. So here, the maintain the child health, obviously. So we need to maintain the child health, which will be coming under the primary level and second one is the help the children, help the child achieve his optimal growth and development. Yes. So what is optimal growth and development? Optimal growth. So 1 year baby has to be tried to stand up, right? So 6 month baby. So they have to try to crawl that. The baby has to be crawl and baby has to be do some of the milestones. So 1 month and 2 month, 3 months, same like that. So there is a this one milestones will be there. The baby has to be achieve or complete these milestones. So that we have to say that that is the optimal growth and development. And weight, height, and their activities, everything we will consider the optimal development. And next one is prevent disease and their complications. So these are the three main points will be coming under the primary level. Next one is a secondary level. In that secondary level, nurse has to be provide the care to the sick children and their family. Already, the primary we have seen that what we have seen before getting the disease has to be get the immunization, and in the secondary this one. So here already the children got the disease or the sick children, and we have to provide the care to the sick children. So that is a secondary. So let's see what are the things will be coming under. So first one assessing their needs. Yes, sick children. we will assess, we will diagnose the disease. Then we will find out what is the problem, what are the signs and symptoms, what is the diagnosis, what are the differential diagnosis, what is exact diagnosis, everything we will assessing their needs. What are the needs of the patient? Next one, planning for care. Okay, we find out the diagnosis and we will plan. So what are the care we can give? Okay, if the fever patient, we will give the sponge bath and we will give the medicines. Okay, same like that, we will plan as a nurse plan for the care. And the third one, implementing the plan. What is the implement? Then we have to do the procedure. We have to give the medicine. So that is a implement. Next one, evaluate the children condition. Everything has given treatment, care, everything has given, and we will check, monitor the children condition whether it is reduced or how it is. So how is the baby's condition now? So that is evaluating the children condition and providing the health education to children and their family members or their parents. Okay. So after treating the patient, so after treating the children, what we will do here, we will teaching or educating their this one family members, the parents, how to take care of the children because the baby is a sick and the children is sick and how to take care of the children. So we will teach them. So these all those things will be coming under the secondary level. Next, move to the tertiary level. So in the tertiary level, nurse should assist the children to return to their maximal level of functioning following illness and disabilities. Already children was sick, huh? So now it is okay. It's come back to the normal life. I come back to return to the health and maximal level of functioning of their following illness and disabilities is how they will the baby or the children's will be function their daily activities or the routines. Okay, as a nurse depends upon has to be educator, experiencer, job structure, and the professional demands and preventive care, promotive care, curative and health education, restoration health and coordination. So these are the nurses has to be do those things. So in the tertiary we have seen we have to maintain the maximal level of the functioning. So how? How we can be maintain the maximal level of functioning? So nurse has to be do all the things. Nurse has to be educate their family, right? And give the experience to the family members, job structure and professional demands and preventive care before getting the disease. What are the things to be do? And the promotive care, curative care, health education, restoration health and coordination. So these are the tertiary level. And one more thing is nursing task and skills. Here nursing task means general nursing cares will be there. So what are the general nursing care? So when we will write the what this one care plan. Okay, in the care plan, what are the things we will be write? Normal, assess the patient. Okay, assess the patient. We will write and monitor the vitals. Monitor vitals. Same like that. These are the vital signs. Okay, so these are the normal things we will be writing. So you can see here, monitor the vital signs. First of all, assess the patient, monitor the vital signs. Administration of fluid and electrolyte the drugs. Normally we will write administer the IV fluid. Okay, so diagnostic and therapeutic procedure. Is there any procedure? So we will do. And nursing procedures. What are the nursing procedures? Example, we can say the nursing procedures. Okay, sponge bath. Then, what are the other? Nail care. Yeah, obviously, nail care and food care, whatever care, wound care. These all we can say dressing. These all we can say that nursing procedures. Then resuscitation skills. What are the resuscitation skills? Resuscitation skills means come back to the normal life. So baby having any what plaster or there any fracture on the body parts and we will make the baby to come back to the normal life. So that's the restoration skills we will provide and specialized nursing and monitoring skills, vaccinations. Okay, so we'll provide the vaccination and prevention of nosocomial infection. What is the nosocomial infection? The infection spread within the hospital, or we can say that hospital acquired infection. Then universal precaution. Tell me what are the universal precautions? So we know what are the universal precaution. First one is a hand washing, then hand washing, gloving, gowning, then Google's all those things, masks, everything. So these are we can say the universal precautions. So these are the general nursing cares. Then here through the international activities of WHO, that the full form of WHO, World Health Organization, and IMCA, Integrated Management of the Childhood Illness, and UNICEF, United Nations International Children Emergency Fund, other health agencies are providing help to the children, help to the level of child health care throughout this world. So these all are the agencies. So what are the agencies? WHO, IMNCI, and UNICEF, and some other agencies they providing help to children to maintain or to develop their level of the health care throughout the world. So these are the agencies. So nowadays we can say the child care is very much important. It includes. Okay, why very much include? If you are ignoring the care treatment, definitely baby will be having problem complications. Here, what are the child care is very much improved, and that one is a hospital environment for the sick children. So hospital environment for the sick children. Advanced changes in medical and nursing care. We have seen that expansion in independent role of the pediatric nurse. Next one is a pediatric nurse practitioner and pediatric clinic nurse specialist and pediatric nurse master clinicians. So these are the improved things we have seen in the pediatric. So this is about the trends in the then. So we have seen that here, here the changing trends in pediatric nursing. It's very, very important. We'll ask for the 5 marks. You should study this one. And while writing the exam, you have to what you have to mention these are the current pediatric nurse objectives, principles of level of policy in India, and the qualities of good pediatric um, nurse and role of pediatric nurse and the primary level and the secondary level. In the role of pediatric, you have to mention this primary and the secondary, then the tertiary level. So this is about the current trends in pediatric. So we have seen the current trends in pediatric. If you have any doubt, you can comment below the description box. I will be answering you. Can help you guys. You understood this one? If you have any doubts, you can ask. Thank you for listening, my class.